important topic like pathological classification. Under pathological classification, what is pathological classification? Types of pathological classification, that is dystopic classification and metastatic classification. Under dystopic classification, pathogenesis, site of classification, and microscopically how they are look like, and macroscopically how they are look like, and also some summary of the pathological classification. Let us discuss one by one. What is pathological classification means when deposition of calcium salt in the tissue other than the osteoid or enamel is called as pathological classification, or also known as heterotropic classification. It is abnormal deposition of calcium salt and also some other small amount of iron, magnesium, and also minerals salt in the tissue or cells. This is called as pathological classification. Coming to types of pathological classification, that is dystopic classification and metastatic classification. Coming to dystopic classification, means calcification occur in the dead and dying tissue. The normal blood calcium level is normal, there is no hypercalcemia, but absence of disarrangement of calcium metabolism means there is no abnormal calcium metabolism. Then coming to pathogenesis of dystopic calcification, when calcium is occur in two phases, there is initial phase and propagation phase. Coming to initiation phase, membrane of the dead and dying tissue damage, then phospholipid is released. When phosphatase act on the phospholipid, then generate a phosphate ion. This phosphate ion is bind with the calcium to form a calcium phosphate. This is a pathogenesis. Next, coming to site of calcification in the dead tissue like tuberculosis and also area of necrosis. Then macroscopically how they are look like means when calcification appears like a pale chalky white area in the tissue, often felt as a gritty deposits. Then coming to microscopically, calcium salt appear in H&D stain like a deep blue granules or masses. In special stain like one cosa silver nitrate, it look like a black color, and alizarin red as it look like a red in color. Then metastatic calcification, it is deposition of salt in many tissue throughout the body, but deposition of calcium salt can occur in normal tissue, but in various in case of dystopic calcification is occur in dead tissue. Next, come into some disarrangement of calcium metabolism, means abnormal metabolism calcium and result in the hypercalcemia, means increase in the calcium level. Note in hypercalcemia, when they are hypercalcemia means when hypercalcemia result when the blood calcium level is above the 12 mg percentage. Then pathogenesis of metastatic classification, then when those organ that loses acid, then it have a underlying alkaline compartment, and there is rich in alkaline, then this compartment is susceptible for the calcification. Next, site of calcification, there is a synovial joints, ಮತ್ತೆ tendon and systemic artery and pulmonary artery. Causes means hyper parathyroidism and also hyper vitaminosis. And coming to summary of this whole pathological classification, there are two types, dystopic and metastatic. Dystopic classification deposition calcium deposition in dead and dying tissue in various in metastatic classification, calcium deposition in normal tissue. In normal calcium level in case of dystopic calcification, disarrangement calcium metabolism in case of metastatic classification, and normal calcium level in the dystopic calcification, and also hypercalcemia is case of metastatic classification. Causes of dystopic calcification is necrosis, and causes of metastatic classification is hyperparathyroidism.